Week 33. Amazing. Your baby is now over 4 pounds. It's about 19 inches long. Keeps growing and growing, and it's still moving like crazy in there. You may notice at 33 weeks that the quality of the movement starts to change some. You may feel less of those hard kicking movements and more of the rolling kind of movements. It doesn't happen all at once, but you might start noticing that change. It's nothing to worry about, totally normal. It has to do with the decreased amount of room in the uterus because the baby's getting so big, and it can't really move the same way it was moving before. But as long as you're feeling those movements, even if they're a different quality, but you're still feeling a reasonable amount of movement, your baby's fine, and that's nothing to worry about. The other thing at the 33 weeks that you might notice is that the Braxton Hicks contractions may be getting a little bit more frequent and maybe getting a little stronger. Nothing to worry about. You do want to monitor the contractions if they seem to be becoming more frequent. And if you're having more than 6 contractions an hour, I'd recommend drinking a bunch of fluid, make sure you're not dehydrated, lay down and time them. And if that second hour you're still having more than 6, you probably need to call your doctor or go in and get checked. But it is normal to have some increased frequency of contractions at 33 weeks. Another thing that you want to do about now in pregnancy is pre-register at the hospital. You want to ask your doctor. Most hospitals would prefer for you to do that. And all that really means is going into the hospital and filling out a bunch of demographic information. They're going to want to know your address and your insurance and all kinds of things like that they can put in the computer. That way when you come in labor, the check-in process will be much quicker. Believe me, when you're in the throes of labor, the last thing you're going to want to do is filling out a bunch of paperwork. So it's good to do that beforehand. And this is a good time to think about doing that over at the hospital. Another thing that you might notice with your body is this is when people start noticing some swelling, which can be very normal. And you'll notice some swelling in your feet, usually by the end of the day, and maybe some swelling in your hands in the morning. You want to keep an eye on it. If you get swelling only on one side, that could be worrisome, but as long as the swelling is on both sides, that's usually pretty normal. If the swelling gets annoying, one thing you can do is try and stay off your feet, elevate your feet. That will help get some of the swelling out of your legs. Also, decreasing your salt intake may help decrease your swelling as well. So 33 weeks, your baby keeps growing, it's moving, qualities of the movement may change, and your body's starting to get ready for labor with a little bit more contractions.